Good afternoon. Welcome to another episode of the Let Me Shut My Door podcast. This is another episode of our Leadership Spotlight series, where we showcase healthcare executives whose leadership is shaping hospitals and communities across the country. I'm Eric Falt with Executive Search Associates, and today I'm joined by a finance leader whose career spans everything from rural hospitals to billion-dollar health systems. He's led teams of hundreds, driven multi-million-dollar turnarounds, and built strategies that not only stabilize hospitals, but also position them for growth. So please welcome Jason Driscoll. Jason, thanks for being with us today.
Happy to be here.
Well, good. As an introduction, you've spent more than 2 decades in healthcare finance, as I said, working from small rural hospitals to large academic centers. Before we dive into your technical acumen, what first drew you into healthcare finance, and what's kept you passionate about this field for so long?
Yeah, I started wanting to be in healthcare from a very early age. I had a outpatient surgery, when I was about fourth grade time frame. Had a interesting scenario noticed a physician in the background, sort of hiding behind a curtain. Come to find out later, he was an anesthesiologist. And so from that point in time on, I felt that I wanted to really be in healthcare, wanted to be an anesthesiologist and provide care to others. Later on in my life, once I got into high school, I was took an accounting class, which really ended up being more like a bookkeeping class, and realized as far as that, one number just had to equal another number. And, that was as easy as supposedly accounting was supposed to be. And from that standpoint, fell in love with accounting, but married that with the desire to be in healthcare. And so therefore that was the passion that drove me through college to get an accounting degree. And from there, been in healthcare since leaving college.
I really like that you have that vast experience, small rural systems to those large billion-dollar operations. What keeps you passionate about doing the finance work in healthcare?
The passion is always the patient. It's healthcare, especially healthcare finance and in revenue cycle. It can be extremely frustrating, dealing with payers, having to deal with so many regulatory changes. But at the end of the day, it really goes back to trying to take care of the patient. And at times, sometimes you just have to walk down the halls and realize as far as that those people that you are fighting the good fight for are sitting in those patient rooms. And you have to realize as far as, while you may have a tough day, they have it even harder. And so that's the passion that
Right.
really drives me to want to do even more for them.
Excellent. That's one of the things I really appreciate about you. A lot of finance leaders are really just number driven, and I know you still have that passion for the patient and the quality outcomes. So let's talk a little bit more about, how you righted the ship when it comes to hospital finances. One of the things that you shared with me that I really resounded with me was when you restructured revenue cycle operations and you achieved a $40 million increase in cash collections within that first year. An incredible result. Can you walk us through how you identified what needed to change and how you got those teams on board to help that turnaround?
Yeah, first it started with changing the culture, getting folks to actually communicate and to understand what the bigger picture was. Bringing back to that patient to the organization. We needed to collect better, and we needed to do better for our patients and for the organization. It was tearing down the walls of the silos of that communication void. But there wasn't one silver bullet. Once we got the silos taken down, you had to start from the front end. We had software that would allow us to identify insurance, but patient access wasn't doing the greatest job of getting that insurance correct. And so our quality scores were around 85%. And in, a matter of months and trying to hold folks accountable for that, we got it up to 98%. And so when you think about that, yielding downstream the accuracy of a registration, that led to, less denials and more cash. In
Right.
working through the mid-revenue cycle, coding and our CDI staff, they were creating frustration with physicians because of their poor queries. And so I had physician advisors that reported to me to do education to those CDI staff and to the coders on how better to articulate their query, which then led to better responses by the hospitalist and those proceduralists, to where they got better answers, and that changed dramatically our case mix index, which then therefore led to additional cash at the end, after billing. And then on
Right.
the back end in the business office, we changed the process of how the encounters would flow. We changed some job descriptions and how staff were held to what they were being responsible for. And our DNFB dropped by a few days, but even more, the AR dropped significantly, which then yielded to the cash. So, the front end, the middle, as well as the back end parts of the revenue cycle, all working together and actually becoming more efficient, and with better accuracy, led to that huge improvement. And that was all sustainable going forward.
Excellent, excellent. Yeah, I certainly like about your process focus, but I also really appreciate your strategic acumen. You had once evaluated a service line and realized that in some redesign, that it could be a model of care. What made you see the opportunity, and how did you get leadership in those clinical teams aligned to make it happen?
Yeah, it all started from me actually rounding with staff, and just asking them, different questions, and what was going on. And as I walked through the OB unit, I noticed that there were six medical beds there that was sometimes used, sometimes not used. And so I just asked them as far as what actually goes on there, because it wasn't a traditional, OB bed where deliveries were being done. And they gave me the scenarios as to, what patients were actually coming. And then working with the OB director, further investigating exactly what was going on or transpired in those. I worked with her to determine that we were really using that area as a outpatient clinic, but based on the services we were providing, it could have easily been used as an ED, because we were really providing that level of service, but we just weren't billing it for it. And so the OB director and I started looking at encounters, and then doing a comparison of what we did bill compared to what we could have billed. And then once we determined, that could be a $2 million an annual uplift in cash, or revenue, that was easy to get senior leadership as well as the physicians that were going to be impacted by that fully on board. And then, it really took flight from there. And then we were able to reach the goal in a matter of about 6 months after doing all of the necessary requirements from a legality standpoint to make that happen.
Well, I have to tell you, there's not many finance leaders that are rounding on their floors, working with those department heads and really educating them on the impact that their service lines make on the overall organization. Obviously, every finance leader wants to see steady, sustainable improvement. In one of your most recent roles, you were able to deliver consistent gains while also tackling cultural challenges and a siloed team. How did you make that cash flow increase possible? And what does it say about your leadership style?
In that scenario, it was a monumental lift to try to overcome the attitudes and the mindset and the culture that was in that revenue cycle area, specifically in the business office itself. We had a leadership team on the physician billing side, and then we had a separate leadership team on the hospital side. And those two leadership teams did not work well together. And so trying to get those two silos, to come together was imperative, simply because their staff was working pretty much the same denials. Where you had a denial on the hospital side, you had a denial on the physician side, and that rift between the two permeated throughout the entire revenue cycle, to where other leaders were forbidden to come to one side or the other, because staff were told that only one side was loyal to another. And again, so bringing people together to show what the end game really was, that we were there for the organization, we were there for the patients, but at the end of the day, our jobs was to get the bills out the door and collect the cash the most efficiently we could. That became job number one, and therefore everything else was put aside. It wasn't easy by no means, and there's some structural changes that occurred due to that, but what we were able to attain was efficiencies in reducing of the waste in the revenue cycle, specifically on the back end in the business office, because we had different ways of handling things on one side versus the other. And so once we streamlined to where we had one way of doing things, then all of a sudden, the bills started going out the door much faster. AR went down, cash started to increase, and then people understood better the processes, and people could communicate to each side. As one was working on one thing, they could collaborate. Then just two heads together on one problem was better than just one person trying to solve it and being very frustrated.
Oh, I think that's fantastic. One of the overarching principles that I've heard you talk about is the communication, the breaking down of silos. That can be easier in a smaller organization. And you've led revenue cycle teams of hundreds across multiple departments in different functions. What's your philosophy when it comes to leading large teams through both day-to-day operations and big transformations?
When you have really large teams, like the largest team that I've overseen is over 450 FTEs, and healthcare finance is very unique in that it's not an 8 to 5 operation. Whether you are at work or you're at home, whether you're at sleep or you're awake, eating or not eating, you have folks up under your leadership command that are working there at the hospital, specifically in the ED, because it's 24/7.
Right.
And so therefore you can't have a mindset that you're going to be a micromanager or that you're going to control everything. It's just not possible. What you have to embrace is that you have to delegate that leadership to others, and then trust their leadership that they're carrying out the policies and procedures that you have approved and you have provided. How you then end up managing that is through accountability of that leadership team, and meeting with them on either a daily, weekly, every other week basis, depending on the need or what's going on, and talking through those scenarios. As we talked earlier, rounding with the staff is paramount, especially in the patient access areas, just because there's so much turnover usually in healthcare patient access. It's good to have a face, and it's good to meet those staff face to face, so that they feel comfortable and they understand who you are and where you are coming from, and why are you having them to do a certain thing that they may not fully understand, because they are only looking at it from one pair of glasses, or through
Right.
one set of lenses.
Well, that's fantastic. In as today's healthcare market is evolving with AI and technology and innovation, a lot of finance leaders shy away from that technology. And I know you've implemented new tools, new systems, everything from documentation improvements to eligibility technology. How do you approach using this new technology to strengthen revenue cycle performance without overwhelming your team?
Yeah, I mean, there's two competing thoughts there, right? One, you need to better yourself. You need to better the organization. You have to better the process of revenue cycle, because things are not becoming more profitable. If anything, they're getting less profitable,
Right.
and so you have to meet those needs, where they are. But on the other hand, like you talked about, the staff, if you're just continually giving them new things every week, month, day, then they don't know what true north is. And so how you balance that simply, in my mind, is one, you have to listen to the staff, find out what their biggest frustrations are. Where are they struggling? And does the technology help that, or does it not help that? A lot of the implementation that I have done over the last 15, 20 years was solely to assist those frontline staff to make their lives better or easier so that they could get it right. And because that was what was going to lead to better efficiency and more accuracy.
Right.
Yes, AI is viewed sometimes as against the frontline staff, because if AI can do it, then that might eliminate jobs. But I think it is proven, time and time again, that AI is really there to support and help those frontline staff do things
Right.
easier, to where that they can work on things that are much more complicated. And so, it's all in the same vein of trying to do things, cheaper, faster, but hopefully to get more reimbursement out of it at
Right.
the end of the day.
I mean, I think technology is changing, but one of the things that I really like is that, you come up with a scenario or a technology, you implement that, but then you're asking for feedback, right? Is it working? Is it accomplishing what we were trying to accomplish?
Mhm.
And I think that goes right along with, your vision. So you've shown time and time again, you can stabilize finances, create new revenue streams, and lead teams through change. As you look ahead to your next role, what's your vision for how finance leader can not only strengthen the bottom line, but also build stronger cultures and better patient care?
Yeah, we talked about it a little earlier. You said that I think CFOs have to, force themselves to get out of their own office. I think they have to be, out and about, and be seen, on the floors. When I was a chief financial officer years ago, I had a nurse tell me, I was the first CFO that she had ever met face to face. I think that's an
Right.
unfortunate scenario. I think CFOs have to be not only present to, frontline staff, but they have to be key members of the leadership team. Sitting back in the corner, and letting the chief nursing officer or the chief operating officer really take the lead is just not, in the cards any longer, because finances are so tight, and you have to speak up and take that initiative. I think, thirdly, the board for healthcare systems a lot of times are not well educated on what the operations are or what the realities are of finance. And so from a finance leadership standpoint, I think it's, your responsibility as a CFO to educate the staff, or to the board, to make sure that they are aware of what the threats and opportunities are, for the organization. And finally, I think, at the end of the day, you're always going to have to pay attention to the finances, and make sure that the debits do equal the credits.
Yeah.
But thinking outside the box to try to, improve that cost to collect, your revenue per discharge, is always going to be, vital, as well as we continue to move forward with trying to become the most efficient healthcare system in the world.
Jason, I really commend you on the fine work that you're doing. And, not only do you have the numbers acumen, what I really appreciate about you is the communication, how you get your team involved. And that all rolls up to culture. And I think you foster that culture that a lot of the healthcare organizations are lacking. So I commend you on that. So I certainly appreciate your time today. This is another podcast of LetMeShutMyDoor.com and our Leadership Spotlight. If you'd like some more information about Jason, please reach out to me at 303-951-6378, or you can check us out at LetMeShutMyDoor.com. Thanks, guys. Talk to you again soon.